I'm taking a compounded testosterone, estrogen, progesterone cream. I've heard estrogen cream is good for facial skin. Is it bad to rub the cream into my neck? Does it mess with the thyroid at all?
I want her to say, want her to know. Okay. First of all, there's no reason to compound estrogen and progesterone in a cream. Number one, we have FDA approved estrogen, transdermal options, gels, patches, sprays, right? Okay, progesterone. We will never, ever recommend progesterone cream. It will not protect your uterine lining. Okay, it's just not absorbed sufficiently in a transdermal manner. You cannot use progesterone if you're using, you cannot use progesterone cream if you're using systemic levels of estrogen. The testosterone compounded, I'll come back to at the end, because that is one hormone that we sometimes have to compound, and that's okay. All right. So number one, the combo of a compounded product is bad. You know why? Because we don't know where symptoms are coming from and we can't individualize. So I don't like having everything combined, number one. Number two, topical estrogen is very, very helpful for skin health. We know it's really helpful for vaginal and vulvar health. And we know topical facial estrogens are incredibly safe, very effective. Our M4 study showed how effective the M4 estradiol face cream and aloe is. But understand, that face cream is not systemic hormone therapy, okay? So I would not recommend taking a combination estrogen, progesterone, and testosterone, putting it on your face. Is it going to hurt your face? Probably not, right? But we don't have any data on topical testosterone on facial skin. And in fact, we avoid using topical testosterone gel or compounded testosterone cream for low sexual desire. We tell patients, in fact, put it in an area like the back of your calf or your inner thigh, because it can increase hair growth, okay? We don't want hair growth on your face, right? And we have no good data on what topical testosterone is doing to facial skin. So what I would recommend for her is use FDA-approved transdermal estrogen for systemic estrogen, use an oral progesterone or other option for progestin, and get her testosterone, if she's using it for low desire, get it compounded separately, or women can use FDA-approved 1% testosterone gel that is made for men, but they use it at a much lower dose. So those are the two ways we give testosterone for low desire. And we don't recommend testosterone pellets because it makes testosterone levels go really, really high. But what happens is when women are in a menopause care vacuum, they get funneled to doctors who are practicing non-evidence-based medicine and doing red flag things like needless compounding. Compounding has a role for certain medications out there, but not for hormone therapy for the vast majority of women, for estrogen and progesterone. And anybody out there who is telling you that progesterone creams protect your uterine lining doesn't know what they're doing and is actually totally practicing non-evidence-based medicine and putting you at risk for getting uterine cancer if they're also giving you systemic estrogen. So that's a huge red flag. So come to Alloy, we'll help you with your hormone therapy. And you can continue to use testosterone, but separately and appropriately dosed.